When patients think about breast revision, they should know three very important points. Number one is that all the patients that go breast augmentation, they will need some kind of revision down the road. All the implants, they last 10 to 15 years. At that time, they may need some other revision procedures like breast lift, going with a larger implant, or changing the pocket, or tightening the pocket. The other most important point about the breast revision is that you want to make sure your surgeon is board certified plastic surgeon, but also has enough experience in the breast revision that can provide you the best possible results. The breast augmentation procedure is a much more simpler procedure compared to breast revision. When you're doing breast revision, your surgeon should be able to kind of bring many different techniques together to give you the best possible result. And the third most important point is that with the advent of the fat grafting, with the advancement of fat grafting, now we can offer our patients more options. With the use of fat grafting, I can give my patient better result without causing them multiple more surgeries. You can give them more natural look, more natural feel, and that's one of the important thing is not only just you can make the patient look better, but also feel better. The breast revision surgery involves many different things. The key thing is that what is the reason for revision? The patients come with the complaining about how the breast implant feels, the cleavage, the hardness, the size. So all those areas can be addressed, depends on what the patient's expectations are. Most of the patients that they have an implant, they're gonna need to have a surgery. All the implants, they come with a lifespan between the 10 to 15 years. So there's gonna be a surgery down the road to remove the implant and replace them. But what happens also with the patients, with aging of the patient body, breast is aging with them. So the patient may need to have lift, patient may need to have fat grafting to give them cleavage, or patient may need to go with a larger implant. All depends on how the body is kind of aging and how is the quality of the breast tissue. One thing is a lot of patients they ask for is that they want to look natural, but also the other concept is they feel natural too. So when they want to go with the new implants, they want to not only the shape to look natural, but also they want to feel natural as possible. One area that is very common is the cleavage area. A lot of patients, they have an implant, they're not happy how much there's a gap in between. And there's really the only way you can address that is address that tissue in the cleavage. And if it go bigger implant, it's not going to address that because it's going to be heavy, it's going to sag more. So the best way to do that is just a fat grafting to enhance the cleavage. When your patients go through the breast augmentation and they put the implant in, they usually have limited amount of tissue to cover the implant. Thicker the tissue, more natural they're gonna look and it's gonna feel. For the patients that naturally they have a small amount of breast tissue, the only way we can enhance that tissue that covers the implant is the fat grafting. And when you put a fat graft in to the breast tissue, to the cleavage, and to the lower pole of the breast, the patient usually feel the implant. You're adding another layer of soft tissue, so that camouflages that breast implant and makes them feel more natural to not only look more natural, but also make them feel natural too. The patients that they come for the consultation desire augmentation but don't want to have implant. One of the key questions is that how much breast tissue is there that we can put a fat in. The other question is that how much fat do you have in other parts of your body that you can donate for your breast, because you don't want to cause deformity over the donor side in the sake of breast enlargement. So very important to evaluate the patient, see how much fat is available, and then how much tissue is available to put the fat in. So that's going to limit how much augmentation can do to the patient. In general, my goal is to at least increase the breast size with 1 cup. More than 1 cup is unrealistic. It can be done over multiple sessions. It can be done sometimes in combining the implant with the fat, but in general, with just fat grafting, 1 cup is the expected result. The fat grafting process starts with one, evaluating the patient and picking up the area that is best for donating the fat. Patient's love handles, lower abdomen, waist, inner thigh, all these areas can be used for the fat donation. Then the discussion is with that the techniques of the fat grafting. And I use a special technique. I use a lower pressure because I do not want to damage the fat cell that I'm harvesting. It's very important because patients have limited amount of fat and you want to preserve that. And then processing the fat in the very gentle way. You don't want to damage the fat cells with the high centrifugation pressure. You want to do it in low pressure and then transfer it gently with special techniques to the recipient side, using a smaller cannula, using smaller syringes, and also gently. You don't want to push it and shove a lot of fat in one area, which is going to cause calcification. Fat grafting has been performed for many, many years. There are great surgeons that have started that and they have made this fat grafting progress and become a little more scientific way. But it still is very technique dependent. And you can have two surgeons and do the same patient and they're going to get different results because what technique they use to harvest the fat, what technique they use to process the fat, and what technique used to inject the fat, and also selection of the patient. So it's very important to have a surgeon that is qualified and experienced doing this procedure. The things that makes the fat a little bit more predictable is that patient selection, the techniques, and also the experience of combining different procedures for that. But it's still, nobody can do fat grafting at 100% result. We are not there yet. There are studies going on to improve that. They're adding some medication, some other things additive to the fat. But at this moment, there is no technique that's going to give you 100% fat take. Patients that desire fat grafting, you should expect that they're going to get more natural feel to their breast. They should expect that the fat to stay with them as long as the weight's stable. They're going to see some fluctuation with the weight gain and loss, but the fat is going to be there. And they should expect that when they feel their breast, it should feel softer, more natural feel to it versus just having the implant, because sometimes with the implant, as time passes, there's some thinning of the tissue and you can feel the bag, you can feel the rippling of the implant. But with the fat, you don't have that effect.